I always feel like we get to look like heroes when it's like,
yeah,
there's your trigger point. And they're like, oh my gosh, my pain's gone. And like,
you're like, thank you.
Yes.
Thank you.
Yes. Hi, welcome to the WellCore podcast, a resource for anyone looking for real answers for women's pelvic health. My name is Bethany, and in this week's episode, I sit down with my coworker, Meg Schwartz, who is also a pelvic floor physical therapist. We answer some popular pelvic floor questions, and we tried to kind of answer them quickly to get through more so we don't go super far in depth. If you have any questions we don't cover in this podcast, please email us at admin@wellcorept.com. We would love to answer more questions and know what you guys are thinking. Now let's go to the show.
Is it normal to leak urine after you've had kids?
No, it sure is not normal to leak urine after having kids.
Or if you've never had kids, it's also not normal to leak urine. So
yes,
we think that you only have pelvic floor dysfunction if you've had kids, and that's not true.
Should you see a pelvic floor PT after you've had a baby?
Yes.
Yes, you should see a pelvic PT before you have a baby.
Yep.
You should also see a pelvic PT if you haven't had a baby.
You should call a pelvic floor PT right now.
Yeah, right now. Here. It's our number. As we just insert link.
If I don't leak, does that mean my pelvic floor is strong?
Not necessarily.
Yeah, I feel like I typically try not to use the words like strong and weak in the pelvic floor because it's never usually about like the strength of your pelvic floor. It's about like the coordination and being able to like respond to different forces that our body like undergoes, whether that's running or whether that's sneezing or coughing. But it's never that you need to like bulk your pelvic floor.
Yeah. It's kind of it's a skeletal muscle, but it also is like a postural muscle. So it's not necessarily, like you don't need it to be like your bicep. It's
right.
Like bulky.
Right. Exactly. I'm
like trying to think of how I want to say it, but it's like, I mean, a lot of times it's like tight and weak. I hate the word tight too, but
yeah,
that kind of like together. A lot of times when you can't manage pressure or manage the forces that are going through the pelvic floor if you don't have enough like range of motion.
Yeah. I feel like I use that phrase a lot because I have a lot of patients, most of the time, their pelvic floor is tight and they're having symptoms. This is kind of getting away from the question that was asked, but they're tight and having symptoms. And so they still think that they need to strengthen their pelvic floor. And I always explain to them, I'm like, it's not about needing to strengthen your pelvic floor, but like if you're holding tension there and then you go to squeeze, you only have like a very short range of motion. So your contraction feels, quotes, weak. But then I explained that like if we focus on lengthening the tissue out so you can get full range of motion, then your contraction is going to feel, quotes, stronger. Yeah. Which is why, like I said, those aren't my favorite terms to use in the pelvic floor, but like being able to control and coordinate through full range of motion is what I always say like our goal is. And then it works in conjunction with some of the other bigger muscles that you do want strength in.
Yep. Yeah, I like the visual of like a trampoline or like a concrete surface. Like when you jump on concrete, it's like strong, but it doesn't have a lot of give versus like a trampoline. Or trampolines, if you have like a trampoline from like the 90s, the springs are probably not as like, they don't have as much like bounce to them, you know? Yeah. But we need that like rebound effect for the pelvic floor. Yeah. So our organs don't just like slam into concrete.
Yeah, that usually doesn't feel good.
No. It's a really effective visual.
It is. I like your visuals. They're great.
Can pelvic floor PT help with constipation?
Absolutely.
It sure can.
Yeah.
Yep. I always say with constipation, there's always two components. So the pelvic floor being able to lengthen and being coordinated so you can like allow stool to pass, but then there is a digestive component to it as well. So But pelvic floor can help. And then there also might be another piece of that that's seeing a dietitian or figuring that out.
Yeah. Can pelvic floor PT help with fertility?
Yes. Yeah. Mostly by like increasing blood flow to the tissues, and like the fascial work around like the skeletal muscle and the organs, getting so like blood flow, fascial movement, that kind of stuff helps everything work better. Yeah.
Yeah. And I think that anytime you're working on like decreasing tension in the body, you're downregulating the nervous system, which helps with like cortisol and all of that kind of stuff. And so that can help as well.
Why am I seeing more pelvic floor changes after menopause?
Estrogen.
Yeah.
That's a big part of it.
Hormones. Yeah. Estrogen is like a big thing now, like being talked about a lot more, which is great. But it's in like in your joints, in your muscle tissue, or
brain health, cardiac
health, all of it. So when we have like lack of estrogen in our pelvic floor, that impacts the muscle tissue. So it makes it harder to get that like contract, relax component. It makes the organs less elastic also. So it just makes everything, it's like the 90s trampoline.
Yes, exactly. Exactly. We need some WD-40 for those springs,
Yeah.
Yeah. Yep. So the vulvar tissues love estrogen. And so we have muscles that go around the urethra, which help with continence, the vaginal opening, obviously, and then also the external anal sphincter. So that's why you can end up with bowel, bladder, and sexual differences or changes during menopause. And so even just like having like a topical vaginal estrogen can make such a big difference in the tissue quality and elasticity of it, the lubrication.
Yep. And that's become a lot more accessible, even if you've had a history of cancer, that it's a lot more, I mean, obviously it's a prescription, so you talk to your doctor, but a lot of times we're learning that it's a lot safer than we thought it was.
Yeah.
It's just good.
Exactly.
Yeah.
Can endometriosis cause pelvic floor dysfunction?
Endometriosis can definitely cause pelvic floor dysfunction. Because we have pain, we have like blood flow restriction. We often, endometriosis is found on like bowel tissue. So like that causes constipation, and then the pelvic floor responds to that. The muscles tense in response to that. Our fascial systems are impacted.
Yeah, definitely. Anytime we experience like fear, pain, stress, anxiety, your pelvic floor responds to that.
Yeah.
And so a lot of times with endometriosis, the pain is so terrible and there's so much stress because they're trying to figure out what's wrong and all of that. And I feel like your pelvic floor is just responding to all of that. And so you're bracing. So all that tissue can get very, very tight. And then endometrial tissue can be found anywhere in the abdomen. And so sometimes it's in the diaphragm. And so then that can impact the diaphragm's ability to like connect and coordinate with the pelvic floor. Yeah. Like you said, it can be found on the bowels, which can lead to, the bowels being impacted. A lot of times you see pain with sex because of all of the tension in the pelvic floor, back pain.
Yeah.
Yeah. So all of that. Complex.
Yeah.
Complex.
Can my hip pain be caused by my pelvic floor dysfunction?
Yeah.
Absolutely.
We see it all the time.
We sure do.
Yeah.
Yeah. I feel like a lot of times somebody who's been in ortho PT for a long time for hip pain, the pelvic floor can be like a missing component of it.
Yeah. I feel like the pelvic floor is becoming more talked about and like more integrated into like general orthopedics, but it's slow moving. So we see it a lot. And a lot of times I've heard it called like washing a window. So sometimes like externally, the nice thing about the pelvic floor is you can like get to the internal structures of like the hip muscles. And a lot of times it's like way easier to get to those deep hip rotators internally than it is externally. So I'd have seen like some improvement if you were working on it externally, but then feel like we get to look like heroes when it's like,
Yeah.
there's your trigger point. And they're like, oh my gosh, my pain's gone. And like,
You're like, thank
uh-huh.
you.
Yes.
Thank you.
Yes.
Yeah. But yeah, which is something not a lot of people know, but you do
Yes.
have hip muscles that are part of the pelvic floor.
Yes.
So they're very closely tied together.
Yeah.
Does a C-section mean you don't need pelvic floor PT?
I wouldn't be here if that was the case. No, I had a C-section and Rachel has had 3 C-sections. So we're very closely acquainted with C-sections, and you definitely need pelvic floor PT.
Yeah.
If almost more so, because a lot of your body preps to have a vaginal delivery and then it doesn't get to like complete that process. And so the pelvic floor and the pelvis kind of respond postpartum like they normally would. So a lot of times your pelvic floor is more tense after a C-section. And so you're holding more tension there. Plus you've had a disruption in the abdominal fascia and the muscle tissue there. And so like your core isn't working as well. And then your pelvic floor didn't do its thing to get the baby out. So like we have a lot of tension. A lot of times we see back pain, incontinence, pain with sex.
Bowel.
Yeah. Bowel.
Mm-hmm.
Yeah. I had all of it.
Yeah.
So
yeah, exactly.
and now I'm here.
Now you're here. Yes.
Telling everyone about pelvic floor PT. So,
Exactly.
yes.
Yeah. And I feel like depending on the way that the C-section goes, if it was like an emergency or something, I feel like there's a lot of like,
Totally.
like there's always trauma in any kind of delivery, but like not envisioning a birth going the way that you expect it to or want it to. Your body holds on to all of that too. So I feel like there's a lot of like down regulating of the nervous system, that kind of stuff. And also, I mean, it's really important to work on your scar. A lot of people are not told to work on their scar.
Yeah.
And like, I've had a lot of patients who like can't even look at their scar. And, you know, so like being able to like reconnect with your body postpartum after a C-section, I think is extremely important. And there's not another field in which we're like reconnecting that way.
Yeah.
So,
well, and I mean, it's just like wild what we expect people postpartum to do.
Yeah.
Regardless of their birth. But I think C-sections is insane. Just based on like what we see as physical therapists, like when we work in the hospital, any other abdominal surgery, I see them in the hospital to teach them how to get out of bed, how to like manage their pressure, all of that stuff. In C-sections, we're like, take care of a baby.
See you later. Don't lift anything too heavy.
Yeah.
But like in 2 weeks, take your baby in a car seat, in and out of the car, to their follow-up appointment. But we'll see you in 6 weeks.
Right. It's just, I mean, it's insane. So
yeah. So yes, C-sections equals pelvic floor PET.
Yes. Thank you for listening to the WellCore podcast. It was great being here with you. And as always, don't forget to unclench your jaw, unclench your cheeks, take a deep breath, and we'll see you next week.